I am the clinical lead. I am a board certified nurse practitioner in both family and acute care medicine. And I am the lead clinician on the Health for All program, which is part of UAD's Partnerships for Healthy Communities. We're celebrating 5 years this year of delivering mobile health care across the state of Delaware, which includes primary care, healthcare screenings, really working on empowering communities across Delaware. And a big part of our program is that all of it is experiential for students across college at University of Delaware to have opportunity to take that didactic work that they do in the classrooms and apply it in an experiential learning environment to the community. As I said, we are an initiative through the Partnership for Healthy Communities and the Community Engagement Initiative, which you may or may not be familiar with. And our role is really to try and address social determinants of health with community partners to address health and wellness needs across the neighborhoods in Delaware that are most vulnerable and impacted with inequities. And the guiding principle is to really try to train students as future public health leaders. Again, a little recap of our goals. We're really working to increase workforce development, and that can mean hands-on application healthcare careers or individuals that are studying epidemiology, doctoral students that are working on research that's translational. A big part of what I do is work with the students, but I also provide primary care at a street level. So whether it means going into buildings to provide care for individuals that don't have direct access or are not heavily insured. And again, it's all those social determinants of health that we're trying to work with community partners to improve. Again, student engagement is a big piece of all of this. So we're working in collaboration with Delaware residents, partners in the community to really foster this piece of our program. And to date, we have had over 1,000 different students participate in the program. And speaking of which, when you think, what are we doing out there? It's a combination of things. I'm providing a lot of primary care, whether it be episodic or if I am their primary care provider in various settings. I do that on Tuesdays and Thursdays. We also do big vaccination booths across the state of Delaware. We do health fairs. We do projects with different community partners. To the right of your screen, you can kind of see the departments that we've been working with, and it's very varied. I mean, we might be working with Spanish as a second language majors, English majors to derive, different pamphlets that community partners might need, nutrition students, and now I'm really proud to say that we are expanding into an LCSW program. So we have our first cohort student with us for the full year to work on these initiatives in the community with us. And of course, nursing and PT. And then why do we do this? Why does it matter? For me personally, I love this work. It's all about giving back to the state of Delaware and the community that I have grown up in. But we're really trying to expand access to individuals of all ages, backgrounds, locations, regardless, meeting the patient wherever they're at to provide care. And we're trying to address those social health needs, whether it be acute care, chronic care needs, physical or mental health needs, and really looking to reduce disparities and provide access to all human beings. To date, we've helped over 7,000, community members with our program. And then it looks like I lost part of my slideshow here. For whatever reason, we cut off. However, the next slide would be basically a map of the state showing that we go all the way from the tip of Wilmington and Newcastle throughout all 3 counties, and we've started to explore Laurel, Delaware. In some areas where there are more, it's pretty much a medical desert in a lot of the places that we're going. So we feel good about being able to extend our services downstate. I will share with you 2 QR codes so you can see a video about our program and also find dates where we're in the community. We have a website so partners and even patients can find out where we're at every Tuesday and Thursday. And we have a pretty much walk-in basis. If someone has healthcare needs, they can come in to see me unless it's a closed event. So I'll take any questions that anyone might have.